Hello, my name is Carson Smith, and this is my final presentation on the underfunding of public health care in the United States. A little bit about me. I'm a junior in high school at Massillville North Hopkins. I started my own business at 16, and I have over half a decade of experience playing various instruments. I started on saxophone, and I've picked up piano, guitar, and trumpet. Trumpet is the most recent one. I have reached my greatest accomplishment finally of being a contracted member of an international drum corps, which if you don't know, drum corps is like a professional marching band. It's like the NFL, where we travel the whole country every summer. It takes about 84 days, and we do it on tour buses, and we live at a high school gyms, and we power ourselves off of energy drinks. It's a great time. Why did I choose this topic? We have a lot of family friends in the healthcare world, many nurses, a couple dermatologists, few doctors. And I just keep seeing them coming home tired. Honestly, they love to help people, but they're done with it. The deterioration of our public healthcare system, it continues to be weakened by a government that is driven by short-term political and economic priorities rather than the long-term benefits that our healthcare system so desperately needs. Without this proper funding, they can't provide us with efficient, accessible, or cost-effective care, which leads to long-term economic decline and widening social inequalities. The solution is consistent government investment. This will build us a proper, stable, and effective healthcare system. Causes of this cuts to healthcare are the government budget. When it gets tight, they target healthcare. It's one of the first things to go. And this harms us in the long term. Long term versus short term, according to the OECD, consistent funding is necessary because health systems require sustained investment to maintain efficiency and improved outcomes. When funding is not consistent, costs continue to rise. If infrastructure is not paid for and improved and maintained, it deteriorates, which just requires more money. The longer you wait, the more it costs. Variation of states. Even the systems that are put out to help issues like these are not carried over every state equally, or especially every area of the state. Kesey notes that uncompensated care is significantly higher among rural hospitals. Rural communities face more hardships than rich communities. This is an issue. If it's a federal thing, it should help every town equally. Effects of this: a lack of infrastructure. As it deteriorates, as stressed by the OECD, without coordinated services, trained personnel, and reliable infrastructure, healthcare systems become reactive over proactive. This means that they also must focus on the short term like our government is, which hurts them. It puts more people in the emergency room, which leads to higher costs, poor outcomes for patients. Patients are the most important thing. The care they receive is the most important thing. So as a society, Safini et al. Argues that socioeconomic status significantly influences patient satisfaction and access to healthcare services. Sagili and Bandier found that Medicaid improved health outcomes such as birth rates in certain populations, and that without this, these effects could reverse. Excuse me. Financial instability. When patients come in and they can't pay for these rising costs, the hospitals must cover them themselves. This is called uncompensated care, and it greatly hurts the hospitals. It reduces their ability to invest in themselves, according to Kesey, and it causes them to face closure in some cases, which further reduces access to care, which rises the cost of healthcare even further. Limited access. This results in delayed diagnoses, untreated conditions, worsening health outcomes, and fewer patients receiving care, according to Basu. Reliance on emergency services also increased, which once again increased these costs. This is my visual aid is projected results of Medicaid bill provisions by 2034 from the JAMA Network, which was the article that Basu published. Coverage changes among patients by the millions. More patients are not able to be provided for by Medicaid by 2034, and also according to this graph, the number of excess deaths will dramatically increase, and the number of preventable hospitalizations. The amount of delayed care will seemingly go up by 2.5 million cases. This is preventable. I mean, it says it right there, but if we invest in our infrastructure, this number will not be so drastically high. We won't lose this many jobs due to hospitals closing, and no one's working to maintain them because they're not getting paid to. The money's going elsewhere. is causing these costs to rise, and they're putting it on the hospitals. Misconceptions. If government spending is placed somewhere else, it improves overall government efficiency and lowers costs. In reality, underfunded healthcare systems have become less efficient, more reliant on these expensive emergency services that truly help them, and preventative care is cut. Once again, the uncompensated care is transferred to the hospitals and, as a result, the taxpayers, because they end up paying more in the long run when their money isn't put in to the investment that is infrastructure. The OECD explains that underfunded systems tend to rely more heavily on costly acute care services rather than preventative measures. We have to spend more and more money each year on these highly specific surgeries and operations because people with chronic diseases weren't given the daily care that they needed because they didn't have access to healthcare. They couldn't pay for it. Past solutions, the expansion of Medicaid was designed to increase coverage, insurance coverage, to lower the cost for everyone and improve care. However, it was limited by the same things other insurance and other past solutions were, which was inconsistent implementation across states, across areas of states, across rural areas. Huang et al. Shows that expanding insurance coverage alone is not sufficient to address healthcare disparities in rural communities. Limited infrastructure, provider shortages, and geographic barriers continue to restrict access to care even when individuals have this insurance. This shows that we need a solution that attacks the root of the problem. We can't just lower the costs when the things that we're spending all this money on are getting more expensive each year. We need to fix them. We need to attack the root of the problem. We need an all-encompassing solution. And this is done through financial investment, which is one of our requirements here. We need skilled professionals. We need to invest in education and workforce development for these professionals so they are more numerous and more adequate at their position. We need coordinated efforts at both federal and state levels by policymakers, everyone involved. Policies that reduce funding need to be eliminated and revised. Healthcare administrators must be intelligent enough to allocate resources strategically, adequately, efficiently, effectively, so that our money is going to the right place. Community organizations can raise awareness and advocate for this, which will help this change come about faster. And expanding digital health services is just a good idea in general. It will tell people or help them know whether they need to go to the doctor or not. It'll keep people out of like those little clinics, keep them from being so overrun with excess patients, which will save us money on maintenance, things like that. And most importantly, the long-term benefits of these things outweigh the initial cost. Investing now sounds like a lot. We're putting all this money into infrastructure. But if we don't do it now, like I said previously, we will need a complete overhaul of our system. Our hospitals will be falling apart. It's without second thought. We need to invest now before the costs rise too high. Desired outcomes: improved access to care, reduced wait times, cheaper healthcare, and higher quality healthcare services. Preventative care programs would reduce the need for emergency services, would reduce the strain put on healthcare professionals and these people with chronic illnesses, disabilities, and we're just not doing it. We're thinking such in the short term. Our government officials are so short-sighted, and all of these worsening outcomes demonstrate that healthcare funding is not simply an expense, but an investment in the nation's future. Sorry about that. Addressing the counter-argument: some believe increasing government spending on healthcare will put a burden on taxpayers and strain already limited budgets, or that increased funding could be mismanaged, put in the wrong place, spent wrong, done so wrongly out of malice, perhaps. However, these concerns can be addressed by putting strict guidelines on where the money can be put, regular audits on what they can do with it, where it has gone, and transparency. This will minimize, if not completely prevent, potential risks for the or that section of this slide. The first part we've already talked about, however. It could put an increased budget on these taxpayers for a little bit. But in the coming years, this strain will go down and down and down and down and down until we can allocate resources elsewhere. We can spend government money on things other than healthcare, but if we don't now, we will have to spend so much more on it. It will truly burden them, and we won't be able to get out of it either. It will just continue to worsen. In conclusion, the instability of the system is due to inconsistent funding and short-sighted decisions. Policymakers love re-election. They just love being in office. They love that power more than they love their own nation. Excuse me again. Negative effects of them not putting their money in the correct place. Reduced access to care, increased costs, increased need for emergency services, deteriorating population health. Importantly, it's pretty important, worsening health inequalities. Something else not mentioned there is that we will not be adequately prepared for things like pandemics and natural disasters. We won't be ready to act because we don't have any preventative care. We have to spend all these things elsewhere. We don't have the proper infrastructure in place to handle all these patients. We're already short-staffed as is. This is dangerous for the population. And here's our strategy. We've talked about all of that, and we seek a more efficient, equitable, and sustainable healthcare system. Ultimately, investing in public healthcare is not just a financial decision. It is a commitment to the well-being and future prosperity of society. Invest now, lower costs later. Invest now, save your children. Thank you for your time.